Hello, everybody, and welcome to Community Conversations. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. And today, I am very pleased to be joined by, a long-term friend of mine, a person I've worked with frequently here at Atlantic Health System, and somebody who I know you're going to love hearing from today because she is a fountain of information on a really important topic, and that is Dr. Bonni Guerin. She is with the breast cancer program at the Carol G. Simon Cancer Center and Overlook Medical Center. Dr. Guerin, welcome to Community Conversations.
Thank you so much for a wonderful welcome, and I'm really happy to be here.
So this month, it's important, really every month is an important month in the fight against breast cancer. But October is Breast Cancer Awareness Month. So we appreciate you coming in and talking to us about, I guess, a couple of different points we want to make sure everybody takes home from this. But it's an important time for women to be thinking about their health and for breast cancer in general in October, is it not?
Absolutely. I mean, of course, as you said, every month should be Breast Cancer Awareness Month. It's a very common cancer.
Yeah.
It's a preventable cancer for many women.
Sure.
And this is an opportunity. This is a month for us to be reminded, get your mammogram.
Yes.
You know, you'd be surprised to hear that in women that are probably at our highest risk, that like kind of 50 to 70 age group, there's only about 65% of us that are actually getting their yearly mammogram.
Wow.
So despite all the years that we've had mammograms and all of the Octobers, we still are missing 35% of people.
Wow. All right, so tell your friends,
Yeah.
let no word go unspoken here. In fact, it's sort of like our October campaign that we run every year called Ask Her. So keep an eye out for all of that important information. You can go to our website, atlantichealth.org, where you can find about all kinds of information about our Ask Her campaign. You may see some advertisements out in the public, flyers, all kinds of signage and stuff. Really important reminders for you to talk to the women in your life and remind them about the importance of mammograms. So we're going to cover a lot of ground. Just a little bit of a programming note, if you will, about Community Conversations. If you miss any portion of our program, you can find the whole thing on our YouTube channel, which you're watching right now, on our website, atlantichealth.org. You can also go to our social channels where we post links to this program. And so if you miss any portion of it, be sure to check back in and you can see the whole thing. Also, Dr. Guerin and I talk a lot, so no shortage of important stuff for us to say. But we want to hear from you too. If you have a question, maybe a little clarity on something we say. We were really excited by the number of questions that were submitted ahead of time. But please, feel free to put your question in the chat function on the window. We will try to get to as many of those as we can throughout our program. But anything we don't get to, of course, please keep it on topic. We'll try to follow up with you after the program too. So that's a little bit about how this works. So let's dive in.
Ready to go.
We talked a little bit about the importance of mammograms. And so I guess my first question would be for women who maybe have not yet had one or never had one, what can they expect when coming in for a mammogram? How does it work and what's the experience sort of like?
You know, that's a great question because for your first mammogram, you know, like for many women, like your first pap smear or your first colonoscopy, it can be a little bit overwhelming.
Sure.
You know, mammograms are outpatient procedures. I would expect that for your first mammogram, you're probably there for an hour or so, just getting ready, and you get the opportunity to talk to the technician that does the mammogram. The actual mammogram itself probably takes about 2 minutes.
Oh, it's over before you know it.
It's a pretty quick test. The techs that generally do the mammograms are good at explaining every step of the way. And you can simply envision a woman placing her breast on a plate, and they kind of compress it so that they can get a good image. You'll hold your breath for a few seconds while they snap the button, and you'll have your first mammogram. I will say that one thing about a first mammogram that's important for any woman who, let's say, is 35, 40 and looking at her first one. Very often patients get called back. There's no old film with which to compare, so they're looking at you for the very first time. So I think it's important to remember that callbacks are not uncommon for your first and not to be necessarily worried. It's more a reflection of the completeness and the attention that people are paying to make sure they have really good pictures as your baseline.
And what are they looking for? I mean, for folks who are just really coming into this conversation with a clean slate and don't really know kind of how this process works, what are they looking for? Is it a tumor? Would a mammography or would a mammogram help identify those?
Yeah, well, I think the The ultimate is to find an early breast cancer, or even better, to find precancers, which is not something we think about all the time.
Yeah.
We think, well, we're looking for cancers, but we're also looking for things like small concerning areas of calcium deposits that could signal a precancer or a precancer, something that we can actually mitigate and prevent the cancer from ever starting. So mammograms not only are a way to diagnose or to find a cancer, but are an important path to preventing the cancer from ever appearing.
And how successful are we at treating at treating patients, at getting ahead of this disease? We talk about early intervention and the knowledge being such an important tool, but when it comes to breast cancer, how, in terms of the medical establishment, not necessarily us at Atlantic Health, but how successful are physicians at treating breast cancer?
Well, I guess there's two parts to that. How successful are we treating? I would say between 85+% of breast cancer is cured in this country.
Wow.
So this is something that, and the key to that is finding it early.
Wow, yeah.
Absolutely. And then I think another point is, how good is a mammogram at finding breast cancer? Right? It's great. If I can find it, then I have a high chance of being cured, but how hard is it to find? And the answer, from mammograms alone, probably they'll find about 85% of breast cancers.
So really good.
Yeah, good. I mean, there are some women that may have a bit more challenge, women that have denser breasts or more complicated breasts. And for those women, there are other things, ultrasounds and MRIs that we can use as adjuncts or helpers to help figure out puzzles in a mammogram.
So I'm going to ask you one follow-up on that, because one of our questions that was submitted to us by one of our potential viewers is about breast density. So for folks who may be unfamiliar with that terminology, what is breast density and how does it affect
So really
them?
simply put, cancer is white, and dense breasts are very white breasts. They're generally, we see dense breasts in women that are younger, lower body fat women, where the breast itself is just filled with breast.
Okay.
So when I was 20, I had dense breasts. They were perky and firmer, and then I became 30 and 40, and my breasts were no longer extremely dense. They were
changed.
less dense, and as you move on, but as we get older, the breasts become darker, and it becomes easier.
On the
and
screening,
easier.
you mean?
Yeah, so
Yeah.
it becomes easier and easier to see white calcium or cancers, which are generally white.
Okay.
So density is a challenge for us.
Because it can kind of camouflage.
Absolutely. It's like looking for something white in a sea of white.
Right, sure.
It also is a risk factor for breast cancer. So a woman that has inordinately dense breasts,
Okay.
not only is it harder to find, but she has a slightly higher risk of developing a cancer. So if a woman that has dense breasts, sometimes we'll add in an ultrasound right from the get.
So you can
So we can kind of try to
have an extra
overcome
tool.
that.
Yeah.
Exactly.
So Marcel has a question, and thank you, Marcel, for your question. Is there anything a patient can do to decrease their risk of breast cancer when it comes to density? So she provides a couple follow-up questions, but I think the spirit of her question is essentially, is there anything you can do about breast density, either through diet or exercise or anything like that?
There
or is
are
it kind of is what it is?
There are
Oh, okay.
medications that can do it. I'm not sure that I would want to put a patient on a medication merely to change the density of her breast. I think that might be a little bit of an overreach. I think just finding out how dense you are and then doing the additional imaging as indicated, whether, like I said, that's an ultrasound or an MRI. As far as what you could do, and I think probably the better question is not what can I do to decrease my breast density, but what could I do to decrease the breast cancer, which is really
Sure.
the ultimate. So are there dietary things? Sure. Low-fat diets, maintaining an ideal body weight, regular exercise, alcohol can increase one's risk of breast cancer, and an overlooked one is smoking. We always think of smoking as being tied to
Lung cancer, sure.
Exactly. But and others, cervical cancer, esophagus cancer, bladder cancer, but breast cancer is an important association with cigarette smoking.
What about family history?
Family history, absolutely. Now, here's the thing about family history. Breast cancer is common. In the United States, it's 1 in 8. If you're a Caucasian and you're fortunate to live in the great state of New Jersey, you're now at 14% instead of 12%.
Oh, wow.
So you're bound to have family members that have breast cancer. You have 6 or 7 women, one of them is probably going to have breast cancer. But we're looking for women that have family histories that are special. I have 4 sisters and 3 of them have breast cancer. Or my mother had breast cancer, but she was 32 years old when she was diagnosed. Or I have 3 generations of breast cancer, or I'm of Ashkenazi descent. If you went into Catholic Church and you plucked out a woman, she'd have a 1 in 500 chance of having one of those inherited genes. If you go to Temple, it's closer to 1 in 40.
Oh, wow. All right. Well, look, important stuff for people to keep in mind.
Absolutely.
One of the things we talk about on this show a lot is the importance of having a relationship with a physician, somebody, in terms of being an active participant in your own care. And I'm curious about, just how helpful you think that is for folks to have, a physician who you can work with, talk to, seek questions, answers to your questions. Talk about the relationships you have with your patients and how important that patient-physician relationship really is.
Well, I think my patient population is a bit different because most of my patients either have had a breast cancer or they're part of the breast cancer prevention program. Okay. So I think that relationship can be a bit more intimate if we're migrating through a breast cancer diagnosis. But I absolutely think that, and especially now when lives are complex and it's really difficult for everybody to find time to take care of themselves, that finding that relationship where you can pick up the phone and actually talk to your doctor. Those moments are becoming, unfortunately, they're few and far between.
Sure.
So I know in my practice, I very much value and really grateful that my patients, if my patients call me, boy, I'm feeling like a
connected to them.
I'm feeling. I walk home out of that room and I think, hey, I was a good doctor because they felt comfortable enough to talk to me.
Sure.
It's very cool.
Powerful feeling.
That's a very cool feeling.
We have a couple questions coming in. Charita would like to know, so I guess in terms of identifying what might be symptoms for people to be concerned with, what about itchiness on the skin? If a breast is itchy, is that a symptom of something to be concerned about, or is that more of a dermatologic condition than a breast cancer one?
Well, it certainly wouldn't be one of the most common presentations, but we hear in medicine all the time, anything can be anything.
Oh, yeah.
So if you're itching, what I can tell you is something's not right.
Right.
I'm not at all saying it's a breast cancer, but that needs to be addressed.
Talk to your doctor.
So you got to talk to your doctor. Now, whether you have, maybe it's a new laundry detergent, or maybe you had a bee sting or that you didn't know about, or maybe it's a different kind of a rash, or could it be something? But it needs to be looked at.
Right. Okay, so again, like I said, a couple of questions here. Donna asked, and again, folks, we always appreciate people sharing their particular circumstances here. Dr. Guerin is certainly not going to diagnose anybody over YouTube. So we will try to provide general feedback on the questions we get, but obviously any specific questions are always best directed to your physician, in fact, as Dr. Guerin was just suggesting. So in Donna's last breast MRI, it came up with background enhancement. What is that? Yeah. And will the follow-up mammogram help any detection?
It could. So background enhancement is a common phrase we see in MRIs, and the radiologist may take issue, but I think of those.
You have a little editorial license today.
We call them busy breasts.
Okay.
Often I see that in very young women that have denser, more active breast tissue. And so if you have a busy breast, there's a lot of background noise. And when I'm trying to see stuff and to see a bunch of stuff, it becomes more complicated.
Sure.
So that's unfortunately the plight of the young lady who has an MRI. Becomes more complicated, but that's where having a dedicated breast radiologist and having a good machine and having a reader that I can call and say, hey, listen, there's a lot of busyness in this breast and I can't see anything on this part. Can you? He said, yeah, I saw that too. So what I did was I had her come back and I did a magnification mammogram in that area, or I added in this fancy ultrasound to kind of help figure that out.
So that's a great point, because Jan also said if you have very dense breasts and have a yearly mammogram and ultrasound, is it advisable to have an MRI if maybe you had an aunt or somebody who had breast cancer? So this idea of there being different tactics and different tools you can use here.
Yeah, absolutely. There are women that are at legitimately high risk to develop a breast cancer, and we're trying to watch them really carefully. So instead of getting a yearly mammogram, maybe they'll get a mammogram and an ultrasound. Well, maybe they'll get a mammogram and ultrasound, and they'll alternate every 6 months. They'll have a mammogram, ultrasound, then an MRI, and then another. So they're really being watched every 6 months.
Sure.
For those highest risk women.
We're talking about a lot of different technological tools and adaptations. And when we have conversations with physicians where we do talk about some of the amazing ways things have changed over time and how we care for folks, one of the questions I like to ask is, how exciting of a time is it for you to be practicing medicine when we have new tools and have new abilities to care for people than maybe perhaps we might not have had, or at least not had to this degree in years past? How encouraged are you by the ability we have to provide care for people right now compared to maybe where we were years ago?
Gosh, I can't even, I need an hour. I need 1 hour to tell you this. But in terms of doing mammograms,
Sure.
Well, probably what's the biggest event? Probably 3D mammograms.
Yep, sure.
Which it is my opinion that every woman should have all of their mammograms 3D all the time.
Okay.
I mean, it overlook. We have nothing but 3D mammograms.
Yeah.
We can't even do it 2D. We wouldn't
wow.
even do that. And what I find really interesting is, although we have ultrasounds, we have MRIs, mammograms have improved the survival of breast cancer by 40%, looking back from 40, 50 years ago.
Yeah.
Imagine if it improves survival by 40%, and that's looking at the old-fashioned 2D. Imagine what the contemporary imaging is really doing. If that almost halves your risk of dying of breast cancer, imagine what doing 3D, layering in MRIs, ultrasounds, imagine really what that's doing. So when we think about getting your mammogram, we're talking about probably more than half your risk of dying of breast cancer.
Incredible.
And it's a big breast cancer in like the 50-year-old decade.
Mm-hmm.
That's the #1 killer. And I can half your risk of doing that.
Wow.
So I would say to women, not only get your mammograms, but for every husband, every sister, every son, daughter, mother, father, anybody out there, you need to look on your right and your left and find some woman and ask her, did you have your mammogram?
I can't say it any better than that myself, folks. Dr. Guerin,
there you go.
It has been a pleasure talking to you today. Folks, if you are looking for any more information about anything Dr. Guerin and I covered today, or maybe something we didn't get a chance to talk about, maybe you were afraid to ask it on the chat, but you just want to go out and do a little more research, please go to our website, atlantichealth.org. You're going to find all kinds of information there. There is a search bar right there on the homepage, and then there's the link for the Find a Doc information if you're looking for a physician to craft one of those important relationships we were talking about just a short while ago, or even maybe you want to find some information on Dr. Guerin. She's there too. I encourage you to get out there and check it out. It has been a tremendous pleasure talking to you today. Thanks so much for coming in.
No, thank you for inviting me. This is fabulous.
We cover a lot of ground here, and we hope you guys enjoyed listening as much as we enjoyed talking about it. Please stay subscribed, please, to our YouTube channel where you can find this and all of our future community conversations, because maybe if this topic wasn't for you, you never know when we might do one that is. So thank you so much for tuning in. On behalf of Dr. Guerin, I'm Luke Margolis, and we'll see you next time.